Welcome to episode 3A of the Career Cumulus Spotlight. Over the next several episodes, we'll start focusing on the role of a nurse. Today, Joanne is going to walk us through a day in the life of a nurse. When you look at your life as a nurse, what was a typical day as a nurse like?
Busy. It more or less starts the same. The ongoing shift, giving report to the oncoming shift. The focus changes from just looking at the respiratory aspect as a therapist to looking at the whole picture. Okay. So you're getting report on the whole system of the body. I'm reviewing charts because I want to know what are the orders, making sure that I'm confirming things. And then I would go ahead and after I researched everything to make sure that everything's compatible, know and kind of chart out how my day would be. Because especially in an intensive care unit, because of the acuity, you need to know that patient very well. You are in there charting every hour between vital signs, which is like your heart rate, your respiratory rate, your blood pressure, and so forth, to giving the medication. Sometimes I would be giving medications almost every hour. A typical day, once I got report, I reviewed the chart, make sure my orders are correct, because just because it's written in my paperwork doesn't mean I want to compare the two. Make sure that this is the medication that's ordered, this is what's on this paper, it's correct. Then I would go in a big part, assessing my patients. You know, with technology nowadays, you have monitors giving me my heart rate and everything, but you got to not just focus on that. I had a very wise physician tell me, you always look at your patient first. That's when you're going to see any issues coming up. Look at your patient. Because numbers can say one thing, but your patient will always give you that true picture. So we would assess the patient from head to toe. Then I would go ahead and after I've assessed it, make sure that things are where they're supposed to be, that the tube going into the patient's stomach is, in the right, correct place. Then I would head out and start looking at, do they need to have their blood sugars checked? Do I need to give them medication? Do they have medications due? If they have medications, what type of medications? Because I'm not just gonna give you a medication. No. I need each medication interacts different and affects a different area of your body. So if I'm giving you blood pressure medications, I'm going to make sure that your blood pressure is okay. So I review the labs. I review the x-rays. I know that patient inside and out. And then in between that stuff, I'm working with that respiratory therapist. So I'm working with my PCA, which is our patient care assistant, like a nursing assistant, turning the patients. Because one of the things you don't want to go ahead and have your patients have sores. You're doing mouth care, you're doing facial care, you're washing that patient, but talking with the family members, giving them updates, giving them that emotional support. Because this is a very tough time in their lives. Working with the doctors, because maybe you notice something and you're saying, hey doc, I'm having this issue. I need orders.
So it sounds like some of the themes that I'm hearing is, number one, other roles or individuals that you're interacting with are the patient care assistant, the unit secretary, you're interacting with the doctor, you're interacting with obviously the patient, but also the patient's family. It sounds like I'm also hearing like attention to detail is probably going to be really critical to the success of the role, as well as empathy and probably a little emotional intelligence there as well. Is that accurate?
Correct.
All right. Thank you for joining us today. Stay tuned for our next episode where we will look at the hours, pay, and training required for the nursing profession. Don't forget to like, comment, and share this post and follow us for more career insights.